Good evening, everybody, and welcome to our latest webinar on COVID-19 vaccination. My name is Alan Riley, and I'm Head of Information and Technology with the Irish Pharmacy Union. I'm going to be talking to you later on in the presentation about the HSE PharmaVax program, the system that you'll be using for recording the vaccination information in your pharmacy. Karina Hull from the HSE, the Operations and Support Manager for systems such as HealthMail and others, will be joining me for that part to talk about the support that will be available to you. Joining me this evening is my colleague Claire Fitzell, who'll be talking to you about the Janssen vaccine and the operational guidance for that. So just some housekeeping before we start. All your questions, if you could put them into a box down the bottom, there should be a box there for questions, and we'll see them pop up here, and we'll try to get those towards the end of the webinar. If we don't get to all your questions, we'll update our FAQ to make sure that the answers to everything you ask is in there. Claire's going to go through the learning objectives in a minute, then she's going to talk to you about the operational guidance for the vaccination program. I'm going to talk about the PharmaVax system, access to the system, setting it up, using it, that kind of thing. And then at the end, we're going to get to some questions and answers. So I'll hand over to Claire to go through the learning objectives.
Good evening, everyone. It's nice to see you all. I think it's 6 weeks since we saw you last. So hopefully you'll find this webinar informative and supportive in terms of the rollout for the Janssen vaccine in community pharmacy. So just in terms of learning objectives, the first one is that you understand your role in the community pharmacy in the national COVID-19 vaccination programme. You can identify the key operational guidance for the Janssen vaccine, and you'll also be able to identify how to access the HSE PharmaVax system, and that's kind of important in the context of the HSE cyber attack and what we can do to support ourselves in getting access to that system and not needing to have additional support. But it's great to have Karina with us today, who will talk us through that support if we do need it in our pharmacies. Then we're going to look at how you configure your HSE PharmaVax, and we'll be focusing on what that means for Janssen vaccine in your pharmacy, and then to recognise how to record a vaccination event, and I'll talk you through exactly how to do that, and we'll talk through some of the support tools that are available from the HSE in terms of some of the patient information leaflets. Then we'll explain the supports available, and then I just want to finish at the end before the questions and answers section on some key documents and support, because I understand that some stuff lives on the immunisation, information has been sent to you via email from the HSE, and I want to just pull everything together so you know exactly where to look. So just in terms of, the next slide, apologies. What I want to cover in the operational guidance is just an overview of the vaccination programme and where community pharmacy is involved. The communications, now this has been a key question coming into us in the office over the last couple of days since you've got the email out from the HSE last week, so I'm going to go through that quickly. I want to specifically talk about the COVID-19 vaccine Janssen, and then we'll talk a little bit about the SOP that we have on our website for that product, the vaccine equipment, and finally the patient journey before we move to Alan and Karina, who will talk through the PharmaVax system with some support from myself. So just in terms of the community pharmacy involvement, you will have, well, first of all, heard the Minister's announcement, and they wanted to get pharmacists involved in the vaccination programme, and we're involved in 2 phases. Phase 1 is the Janssen vaccine, and that's for everyone over 50 who hasn't yet got a vaccine through the CVCs, the Central Vaccination Centres, and that's approximately 140,000 people who are unvaccinated at the moment. Now, we don't know why they're unvaccinated, whether it was a difficulty in logging onto the system, whether it's been a transportation difficulty for those patients, or whether it's vaccine hesitancy. And the HSE very much felt that community pharmacy were in a good place to support those people because of our accessibility and because of our knowledge in terms of medicines use, and to be able to answer their questions. The second is the Pfizer vaccine, and that's a smaller subset of about 350 pharmacies. I know the HSE has been in touch with quite a few pharmacies already this week on that front who expressed an interest through the second EOI, and those phone calls are ongoing at the moment, and emails. And that's really to strengthen the geographical spread of the vaccination rollout, the HSE's vaccination rollout, to areas of the country where there a large travelling distance to one of the central vaccination centres to make it more accessible for the local populations. So that's the involvement at the moment. And again, we are aware that the vaccination programme and potential boosters are coming down the line. Now, this has been a key question, so I'll just talk a little bit through this, what is actually happening in terms of the communication plan, because one question coming into us in the office very much is I don't know if I have that number of people in my area and whether they have or haven't been vaccinated. One good news is the HSE are planning to spend quite a significant amount of money over the next 2 weeks to encourage those people who have yet to get a vaccine or have struggled to attend one of the central vaccination centres. So they're spending money both at social media and at local press level, and I've just put some indication as to what that would look like on the right-hand side of the screen now. It may be subject to some small changes, but that's the kind of theme of the support that they will be putting in. They'll also list on their website all the pharmacies that will be providing the vaccination service. So any of you who have gone back with a positive, yes, I'm getting vaccines in, you will be included on that listing, and people will be directed through local media to your pharmacies, the pharmacies in your area. So there will be local press done in the local media, as well as a centralised press at a more national level. There will also be a press briefing announcing pharmacy involvement and actually the key role that we have in trying to reach those hard to reach vulnerable populations. So in terms of what does that do for community pharmacy, it sets us in a place that we are providing care for people who would otherwise not get vaccinated. There will be HSV branded posters, that's like the one on the right hand side, that you'll be able to use to advertise that it is happening in your pharmacy. And the one other question that's coming in a lot is, do people book through the portal system? No, they don't. They walk into you and you locally book them into an appointment, and that will be clearly made that message on any communication coming from the HSE. So it will say that you don't need to book it in through the portal system. You can walk in and talk to your community pharmacist. So that's the communication plan. It's due to kick off next week, and as we have more information, we will send that to you as to what that looks like. I know in the previous webinars we were talking about AstraZeneca, and I think times have changed, things have moved on. So I wanted quickly to talk through the Janssen vaccine and what you need to know that's really important for your pharmacy. The first thing is, and most of you will have had phone calls from the cold chain or support from the cold chain in terms of the vaccine, is that you will be receiving 50 vaccine doses early next week. So it's 14th, 15th and 16th of June are the set dates. And unlike the flu model, it's actually it's a push model, which means you get the doses. You don't have to request the doses from the cold chain. The reason for that is several, but they need to match the supplies, and I'll talk through what supplies you get to the doses. And it's from trial and error with the GPs, the push model actually worked better in terms of security of how many vaccines you'll get, and also matching the supplies, the needles, and the support material to those vaccines. There are community pharmacy relationship managers, and that email address on the screen now, pharmacyvaccines@vision.com, are managing that management of the vaccines to your pharmacy. So if there's an issue there, that's the website to use. Now, we will be putting all of these support websites on our website, so you'll know where to go for what information over the next little while, and that should support you in terms of if something you have a query about one aspect. I do know that the HSE are also planning an FAQ document that will be sent out to pharmacies who will be involved in the vaccination programme, and that will also help support some of the queries. So, for example, one query coming in today was, can I vaccinate someone over 70? The answer to that one is yes. This is to really catch everyone over 50 who has missed a vaccine. So these people are at the most vulnerable the older they get. So absolutely you can, and you deal with those people over 70 in the same way as anyone from 50 to 70. So in terms of the Janssen vaccine, a few important things, and I'll go through on the next slide some important details in terms of storage conditions for this vaccine, but it will arrive from the national cold chain at 2 to 8 degrees, so very much the same as any other fridge line coming into your pharmacy. The key thing is, once you puncture that vial, it is only good for 3 hours. Now, on the SMPC, it says it can be kept for 6 hours once it's kept in 2 to 8 degrees after puncture. But operationally, that would be impossible to do, because as soon as you take it out, you're out and in giving doses. That 6-hour advice would no longer stand. So the bit you need to think about is there's 5 doses in each vial. I need to factor in appointments within 3 hours to use those 5 doses. I'll leave myself some time to deal with any no-shows or contingency lists. So that's the key one, is the 3 hours from when you puncture it. This vaccine is not dilutable. You don't need to add any dilutant in it, and it is the 0.5 ml dose, and it is an intramuscular injection. Most of you at this stage will have done your Janssen specific vaccine training, and I've got a link further on if you haven't done it as to where to get that training, because due again to the HSE cyber attack, HSE land training is down at the moment. So the good news, and again it is a good news story for people who do avail of this service from pharmacies, is that this is a 1-dose vaccine. That's quite attractive for most people in terms of, especially people who would be a bit hesitant over needles. That is 1 dose, and actually they get their immunity from 14 days up to 28 days after getting the vaccine. There is some aspects in terms of use by an expiry date, which I'll talk through on the next slide, and there is some important stuff in terms of how it arrives into the cold chain. So first, just go to that. So the expiry date of the vaccine on the outer packaging is the expiry date that it would be if it was stored at -25 degrees to -15, so the cold storage conditions. So that expiry date is null and void by the time it comes to your pharmacy, because it will have been stored by the national cold chain at +2 to +8 degrees fridge temperature, and then it becomes a use before date. So when you receive it in from the national cold chain, the expiry date will be marked out and the use before date will be in. So that's important when we talk about the PharmaVax system as to what you put in different sections of your batch recording details. So that use before date will be in the outside box only. Because at pharmacy we still have to FMD our products, the individual files inside will still have the existing expiry date, but what you need to record is the use before date, and obviously the use before date is a date that you have to use it before. The discard time is the time from the 3 hours, and I've just put on the slide there, they recommend that you use the 24-hour format. That's just to make sure that there's no, it's less likely to make a mistake as to how to read it and what time it was given. So example here is it was given at 1300, discard time is at 1600, so 3 hours later. So that's important, and I've the diagram from the SMPC there that shows you where you write that detail. Just as well, on the bottom of the screen, you will, if you've done your HSE land training, you'll have seen this image. I have taken it from the HSE land training, but just to explain that your expiry date will be as the original expiry date, and that's not the expiry date to go by. It's the use before date, which is in the outer packaging. So in the SOP that we've designed, and also in the clinical guidance on the HSE website, it does say to keep it in its original box. That the reason for that is so you have correct use before date, but also it is how it should be maintained to keep it stored upright, etc. So that's just the 3 different dates and times in terms of expiry date, use before, and discard date and time, and why they are important. Another key query has come in terms of the HSE equipment. So this is included in the operational guidance, but I just thought it would be worth reiterating what comes along with it. And you're probably, some of you pharmacies might be receiving this already, but it will usually arrive 24 to 48 hours prior to your vaccine supplies. So if we're getting vaccine supplies 14th, 15th and 16th, you should be seeing some of this equipment coming in over the next day, and it will arrive in one lot. So you get your sharps container, cotton wool, kidney dishes, hand disinfectant masks, gloves, sacks, and then you get the equipment for the specific vaccine, which is the vaccine Janssen, which is your syringes, your needles, and alcohol swabs. Another query that's come into us is in terms of the adrenaline. You order them in the same way you'd order adrenaline for a patient, and then it's detailed out in the HSE operational guide how you get reimbursed for those adrenaline that you need to run the service. So Don't worry if you haven't got it. It will arrive in time. It just feels like it might be last minute, but you will get it. So just trust in the system. The HSE have had enough practice in this in terms of delivery to GP surgery, and they have now got the operation, and that's part of why that push model is currently working. So next off is just in terms of the support material available, and the one or two things I wanted just to pull off again. These will be supplied to your pharmacy, are the HSE leaflets and the Janssen leaflet I've got on the image there. The patient information leaflets, that's your pill, will also come in a form from the HSE, and I think some pharmacies are already receiving them. The aftercare leaflet, that's for the patient aftercare, and obviously with the Janssen vaccine, like the Vaxzevria vaccine, that's important that in the patient counselling we go through potential side effects of blood clots, and that's all detailed out in that aftercare leaflet. Vaccination record cards, and I know myself and Pamela would have covered this in a previous webinar, but they are important that you keep those vaccine record cards in a safe place. Unfortunately, they could be liable for abuse. I'm not sure why anyone would want to do it, but do keep them safe and don't leave them in your consultation room between vaccinations. Just in terms of the cohort that we will be vaccinating, it's important that you realise there's a fair bit of resources on the HSE website for people who potentially are hard of hearing, or the English isn't their first language, or they would prefer to see videos or an easy to read format. I have put the link at the bottom of this slide, and there is pretty much, I think, 5 pages of different languages for the leaflets. So one reason why potentially someone hasn't got a vaccine at this stage is that English might not be their first language. And again, the accessibility that pharmacy have for people and the HSE promotional plan will be targeting people. So that might be a valuable resource for you if that applies in your particular area. Just in terms, and I know I mentioned this already, but booking vaccination appointments, you have to book them in 5 vaccines. There are some vaccines that you get an extra dose out of. Very much from our chatting to colleagues who are working in the central vaccination centres and our colleagues in the HSE, getting an extra dose out of the Janssen vaccine file doesn't seem to be something that you can actually rely on or book in an appointment for. That's different for other vaccines, but so we wouldn't be recommending that you book an appointments for any more than 5 patients at any one time. And of course, you have to book those vaccines over the 3-hour period. Again, I think I would have mentioned this before in the AstraZeneca webinar that we did. You do want to leave yourself some time to work a contingency plan if someone doesn't show. So if you can do them at a half an hour space or 15-minute space, that gives you some time at the end if someone doesn't show to contact someone on your contingency list. In terms of having a contingency list ready, and I know there is concerns out there in terms of the number of people who potentially fit into this group and whether you'll get them or not. Or one way around this is to keep the names and phone numbers of anyone that is interested in it, and once you have 5, arrange the appointments in that manner, rather than arranging appointments and then not having the 5 to fill those vaccine file. It's important that the patient is advised to wear a loose top. We could potentially be dealing with people who are a bit shy of needles. So again, anything to make them more comfortable, it would be ideal to do that in advance. They will need their ID and PPSN number, and just in terms of what ID can be used, in Appendix 5 of the HSE's operational guidance, it details all the different IDs, the main ones being driving licence and your passport. So I want to quickly talk through the vaccination journey and where does the HSE PharmaVax fit into it. So that will help with Alan and Karina when they talk through the PharmaVax system. So the first bit was communication to population cohort for them to contact the local pharmacies. So that starts on Monday by the HSE, and it's already started in terms of the social media from various politicians explaining to their constituents that they can get the vaccine in the local pharmacy. I know talking to some members today, they've already put up that information on their websites, and they're already getting quite a lot of interest in terms of people wanting to look to get an appointment. Patients, then you make an appointment for them. You explain which vaccine, so anyone who's gone to the central vaccination centres, you will have been told in advance which vaccine you're getting. There is no choice for someone if they're choosing to get a vaccine in a pharmacy. It's Janssen at the moment. So you would provide them with the Janssen information leaflet and answer any questions they have on that vaccine. 24 hours before they come for the appointment, you want to check they're going to turn up again, so there's no vaccine wastage, but also to make sure that they don't have any signs and symptoms of COVID-19. I think we nearly forget sometimes that it's still out there, but it's important that we still do that pre-screen. When the patient presents, you need to check their identity and confirm that they're eligible for the vaccine. You might want to do that even before they present. So there is a HSE eligibility checklist that can be found on the www.immunisation.ie, and that's a one-sided or two-side page for each vaccine. Now, the same checklist is for the Vaxzevria vaccine as it is for the Janssen vaccine, but that goes through a series of questions to make sure that the patient or the client, in this case, is suitable for the vaccine that we will be using, and it explains what to do if they're not suitable. So you will get that, and again, that's essential that it's done prior to vaccinating any individual. You will go through your normal consultation the way we would with anyone, and there will be some difficulties. We may have some vaccine hesitant people coming into our stores if they haven't presented for vaccines already, and we will take informed consent, which will talk you through how to check that off in the PharmaVax system. You will then administer the vaccine and they will wait for the 15 minutes. So all of us who filled in the EOI will be very aware of where they'll be sitting and for how long they'll be sitting, because that was one of the key considerations that the HSE requested of us, that we'd clearly space out the people so they weren't going to be within the 2 meters of anyone else. So again, you just apply the sense you would have put in your EOI in terms of where they'll wait for that 15 minutes. On the right-hand side of the screen there, I just have our when to leave docket. Again, that's on our website. You can fill that in so that if you're busy, the person knows that they've been waited 15 minutes and can leave. Administration record, again, you finish that off on the HSE PharmaVax system, and you give the patient their record card. The record card is important that the person keeps it because it will remember which batch they got, but you'll also have an electronic record in the pharmacy. The patient is supplied the pill and the aftercare leaflet that I mentioned earlier on. And I suppose one of the nice things about pharmacy in the vaccination programme over the centralised vaccination centres will be that if someone is concerned post-vaccination, that they know where to come to talk to you about it, or to come back and talk to the person who gave them their vaccine. All the COVID-19 vaccines are black triangles, so any side effects, any adverse drug reactions do need to be reported, and you will be well aware of the various HPRA communications in terms of the vaccine events at present. There's very few or very little information on the Janssen vaccine because it's relatively new into the country in terms of the side effects reported in this country, but we will be expected, like any other healthcare professional, to log any side effects that patients have who get vaccines from ourselves. So just finally, before I finish, I just want to talk through our SOMP template for the COVID-19 vaccine. Version 5 is on the website, and actually there will be an additional update and version 6 will be available from tomorrow. Version 5 is updated to reflect the operational guidance of the HSE that the COVID-19 vaccine was to be used in those aged 50 years and older. And then the other change that will be made, and version 6 will be available tomorrow on the website, will be in terms of withdrawing the dose, and there's an inclusion of an image as to how to withdraw the 0.5 mils dose from the multi-dose file. So that version 6 will be available tomorrow. I know a fair few of you supervising pharmacists out there will be spending the weekend adapting that for your own pharmacy. What you're welcome to give us any feedback on the current structure of it, but the NIO have looked at it today, and the version 6 is as up to date as the guidance can be at present. It is worth noting that the only thing that's kind of constant in this whole vaccination program is that it's ever changing. So unlike flu vaccinations in the past, you will need to keep an eye on the SOP and any SOP changes that are made over the course of the next month, because new information is coming out, new guidance is coming out, and we will keep that SOP up to date. So any communication that you see coming from us, which mentions the SOP, you will need to reflect whether you need to change your own SOPs in your pharmacy to match that, and subsequently train any vaccinators in the use of that vaccine. Just a clinical query, and just to give you the up-to-date email address. So any clinical queries you have on the use of that vaccine, go to the NIO, the National Immunisation Office. Like the rest of the HSE, unfortunately, they're still suffering from their cyber attacks. So there is a Gmail address at the moment rather than a normal HSE email address, and I've put that on the side for clinical queries. But the immunisation.ie website is it's got a wealth of information to support you, and again, we're happy to support you as well in any way we can. And at the end of this session today, I will go through exactly where to find different bits of information to support you. So I just want to hand back to Alan now, who's going to talk a little bit about the PharmaVax system.
Okay, thanks for that, Claire. These slides will also be on our website tomorrow, so all those links will be available to you there, along with the recording of this session as well. Next slide, Claire. Okay, so I'm going to be talking to you about the HSE PharmaVax system. You might have seen this slide before. We've used it a couple of times before. The PharmaVax system is a web portal, not unlike the flu system. Now, it's a different system entirely. It's on a different platform, but it is a web-based system that you'll be using for recording your pharmacy information, your vaccination information, patient, and the vaccination events in your pharmacy. It's useful to note that it is not a decision support tool. So we'll be looking at some screens here and the information that you're going to put into those screens. But the system is not going to stop you from pushing in information that might not make sense. So just be careful about the information that you put in. Once you hit save, it's quite difficult to change that information. And in particular on the kind of clinical screens where you're recording the vaccination event, just be careful the information you're pushing in there. The PharmaVax system is a web portal, as I said, and records the pharmacy level vaccination information. That makes its way into the national system called COVAX, which I'm sure you've all have heard of before now. So the information you gather will make its way into a national register of vaccination records. The information is also used by the PCRS for reimbursement. So you're recording this information for two purposes, as a record of the vaccination event, but also to get reimbursed for providing that service. So next slide. Okay, so you will access the system. That URL at the top of the slide there is the web address of the PharmaVax system. You will be getting an email from the HealthMail team telling you when that system is available to you. HealthMail plays an important role here in PharmaVax because your username and password for HealthMail is your username and password for the PharmaVax system. So I would have advised in the past, and I'd still advise it, it's just useful that when you get an email from the HealthMail team to say that the PharmaVax system is available to you, if you open it on the same computer that you just received that HealthMail in, it just makes that logging in a bit easier. A pop-up there, like that box there, will pop up with your HealthMail account, and you'll click on that, and the likelihood is your password will be saved as well to let you get through that way. If not, you can just use your HealthMail username and password if you're going to log onto the system from another laptop, for example, or another computer in your pharmacy. And we'll just go on to the next section and next slide, and I'll talk about two-factor authentication. So don't worry about the term, it's something we're all familiar with from using banking systems and things like that. When you log into this system for the first time, and when you log into the system every day, you'll be asked to put in a 6-digit verification code. So that code is going to go to your secondary email address. So you would have seen a survey come out, an email or a text come out from HealthMail a few weeks ago, just to confirm your HealthMail credentials and giving you an opportunity to get them updated. So in there, and when you are setting up your HealthMail account, you use the secondary email address. That's where this verification code is going to be sent on a daily basis. If you're using Gmail like I did here, the likelihood is that email is going to go into your promotions folder, not your inbox, well, in your inbox, but the promotions tab of your inbox. So just watch out for that. Or if you're using another email service, just watch out for the junk mail or things like that, because it might go in there. Next slide. So when you get logged into the system, you're going to be asked a couple of questions. So like any website that you might access for the first time, you'll be asked if you want to accept the cookies. So like other websites, you should accept that because that's how the system will work. It won't work correctly if you don't accept those cookies. One of the first things that you'll do when you get access to the PharmaVax system is view and accept the data processing agreement. You can't get any further unless you accept this agreement. The DPA here is not unlike the terms and conditions that you have agreed to for using HealthMail or the DPA that you already have in place with the HSE PCRS. We've reviewed this DPA and it's very specific to the COVID-19 vaccination program and is entirely fit for purpose. But you can look at it as well and then you can accept it before you proceed to the next step. So the next step, and the system is quite good this way in that it walks you straight through to this screen here, which is setting up your pharmacy. Now, a lot of the information that you're seeing here will be pre-populated, such as your pharmacy name, email, and contact details. Your pharmacy's PSI number will be also populated. They're coming from your HealthMail credentials because they're the details that you use when setting up the HealthMail account. So all that information will be populated already for you. Now, if you see anything there that needs changing, we'll talk about that later. There will be a support way to get that fixed, some email addresses that you can do to get that information updated. The two fields that you'll need to fill in here at this point, and again, this is something you need to be careful about because once you save it, that's it saved in your system, is your pharmacy PCRS contractor number. So that's your GMS contract number, and then your NCCS account number. So your GMS contract number, that's needed for reimbursement. So that's something you'll be familiar with and you need to put that in there. Your NCCS account number, we've learned in the last few weeks that people aren't overly familiar with this one. So it's not your UDD account number, it's the cold chain account number. You'll see it on the top of a docket that you might have got recently, or because you have an account with the NCCS, if you log in there, you'll see that number at the top of your profile. It's a 7-digit number beginning with 3. Okay, next slide. Okay, so once you have your pharmacy set up, you're going to get access to the system. And on the left-hand side of the system, you have 6 different menu items there. You've clients, which is the reference to patients here. You've got vaccinations, where you'll be recording the vaccination events. You've got batches, where you'll record the vaccines and the diluents that might arrive into your pharmacy. There's a report section, and then there's a vaccinator section, which I'll be talking about next on the next slide. This is where you're going to be setting up any vaccinators in your pharmacy. So any pharmacist that will be vaccinating in your pharmacy, you add their details in here. So it's very straightforward form, just their name and their contact details, which is essential to put in here. The role is a drop down because this system can be used by GPs or pharmacists. So obviously you'll be selecting pharmacist, and the pharmacist's personal PSI registration number will go in there. This is how you add any vaccinator into your system, and don't worry if you're using locums or people that are arriving in, because you can come back to this section anytime to add in new vaccinators into the system. Okay, I'm going to hand over to Claire for this one. This is about adding products into the system.
Thanks, Alan. Actually, I might just answer 1 or 2 questions that are coming on PharmaVax at this stage, because I know what it's like when you ask a question and you're waiting to be answered at the end. So the 2 or 3 questions are, when will this be available? So the PharmaVax system is having a soft launch on Monday to 15 pharmacies, and that's just to make sure everything goes okay. And then it will roll out throughout Monday, Tuesday, Wednesday to the rest of the pharmacies. And Karina will talk through that a little bit more detail, but you will get a HealthMail email that gives you the link. I see there's a question coming in saying that you're trying to log at the moment and you go in a cycle. That's because the system is not live. So there really is no point trying to get onto the system until you get that login link through your HealthMail account. So on Monday it starts to go live, and it will proceed from there. Just in terms of myself and Alan and Karina, and everyone in the HC, we've had the system is, it does what it says it does. It's quite intuitive. So there's not a lot of learning, and Alan's just talked through how to get onto the system. So getting onto it for the first time is potentially the trickiest thing to do, and to make sure all your details are correct. Actually using the system, there's not a massive amount of functionality. The left-hand menu tells you how to navigate very clearly, through the system. There isn't a lot of hidden little tricks or shortcuts. It is just the way it is. Now, the functionality may increase and progress over time, but that just answers some of those questions coming in terms of that, and I'll have a look later on to see if there's any more around the PharmaVax system. So in terms of batch creation, this is quite different than the flu portal that you'll be used to, in that the batches are not in the system. And the reason the batches are not in the system is mainly due to some of the cold storage changes for these vaccines over time. It's not a single dose vaccine with one batch. The use by date is dictated by when it comes out of the freezing cold storage into the cold storage. So that's why, for numerous different reasons, you have to create the batch in your own pharmacy. So you'll see in this menu, and there's not much to the screen, it is as simple as what's on the slide there. You pick the vaccine. So the 4 vaccines that are available in Ireland at the moment are available in that drop-down menu that you can see the little arrow for there. So in the case of Janssen, you pick the Janssen vaccine from the list. The market authorization holder will be pre-populated for Janssen, because there is only one market authorization holder, and then you'll need to pre-populate the batch number, the expiry date, and the use by date for that vaccine. Once you save that vaccine will be available when you go to add a vaccination record. So initially, each pharmacy will be getting one outer of 50 doses, which is 10 vials of 5. So you'll only have one batch in your pharmacy initially with one date. So in terms of picking the wrong batch, that won't be possible in the first instance with the one vaccine that you have coming into your pharmacy. So that's the batch. In terms of, that's just what the expiry date and the use by date and time will come in. This is a 24-hour format that you put in, and the use by date is just the way you would expect it to be. So the expiry date, you may or may not be able to see that from the outside of the pack. You may have to go into the inner file to get the expiry date for the Janssen vaccine, but the use by date and time will be on the outer box. And remember that you will need to scan that out and authenticate it when you break any seals on the batches. So once you've created it, you save it. Again, pretty much like any of these, this system, if you don't save and navigate onto the left-hand menu, it's a bit like the IOP in that respect, their website. You come back and the information you put in is gone. So always remember to hit save before you navigate away from a page. And I've just put on the bottom what information needs to be put in for each vaccine, but don't worry, the system guides you through what you need to put in for each batch, because there's a drop-down menu and there's a box there for each batch that you create. I'll just hand back to yourself, Alan, to go through the client information.
No problem. So I'm going to go through adding the personal details for patients here. If you just go to the next slide, it'll be easier to talk through it that way. Actually, before we get into that, the requirements for the information for these vaccination records has been set out in an SI there, and you can read it there. And again, the slides will be made available to you to read it in detail. We do get asked a lot of questions around the need for recording the PPSN, and it is set out here as a requirement. However, there will be a functionality to select if no PPSN is allocated or is available. So there are exceptions to that, but by and large, you will be required to gather the PPSN. It's also used by the PCRS for reimbursement, and the system will be reminding you of that. The next slide, please. So here we are adding, so we're going to just focus in on one part of this screen here, which is around collecting the client information or patient information here. So it's a straightforward form. You're just gathering the demographics of that patient here. What you need to focus on here is that when you're selecting the additional risk factor here, which is you're required to, a lot of these fields are required, you will be selecting none of the above allocation group based on patient's age. So that's the one that you'll be selecting for the patients in your pharmacy, at least initially. You'll see there that there's a box for the PPSN. I believe it will actually check the format of that PPSN. It might even check if it's a valid one. I'm not 100% sure about that, but it certainly checks the format of the PPSN to make sure you're putting in a valid format. But you can select, say, that no PPSN has been allocated, so that is possible as well. And there is a drop down to give you a reason for no PPSN. So that's typically a foreign student or somebody working here. Next slide. So you see the contact information here, that section there on the patient information. There's 3 different things you can collect: an email address, a mobile number, or an alternative contact number. So one of those needs to be populated. So you might have some patients who don't have an email address. You might even have patients who don't have a mobile address, but we need some kind of number for contacting the patient. So one of those fields is required to save that record there. The next part about collecting the address for the patient, if possible, get the error code, because if you put that in there, the rest of that will be auto-populated. And that just can be quite niche. And you can look up error codes online through the error code lookup website, or else you can just type in the address there. Next slide. This is the GP bit. So the last piece of information you need to cache on a patient is the GP. You can just type in a GP's name and it'll drop down there, so you can select them, and then that'll fill in the rest of the details. You can also select to that if they're not registered with a GP as well. Then you're going to be hitting save and new. And the reason I'm saying that is that it's very useful to put the patient information in advance of the day of vaccination, for a couple of reasons. It saves on the administration task, so that there's less time with the patient in the pharmacy, that you have the information in there in advance, and you have a patient list for people that you're going to be vaccinating in any one sitting. But also, and we'll talk about this in a couple of slides, when you put the information in here, if there's any information, if there's any vaccination event recorded against that patient, the system will tell you. So when you go back in to look at those patient details, if they had for some reason a vaccination elsewhere, you'll be prompted to that. So you'll know that before they come into the pharmacy for their vaccination. So it's just useful to put that information in advance and to check it before you start your vaccination session. So next slide. Yeah, again here, it's just, that's the same 3 slides all in one there. So it's one big long form online, and we have a paper form that you can use on our website to give to patients so that they can give you all that information and you can transpose it into the system. We'll talk about maybe waiting lists and scheduling later, but it is useful to have a waiting list of patients, and then when you have enough for a 5-person session, to actually schedule those appointments at once and then put that information into the system at that point in time. Next slide. Vaccination event recording. I think you're taking this one, Claire, isn't it?
Yeah, thanks, Alan. So as Alan mentioned, there's 2 ways to record a vaccine. So you can go, and I've just got part of the side menu here. So the red section is the client section, and you can add a patient there, or you can view your patients there. And there's a vaccination section just below it. You can enter a vaccine by going into vaccination section or adding a client, but I would recommend that you go through the client in the first instance. And I've got an example here where there is a vaccination history being pulled in from another pharmacy or from the COVAX system. So if there is a vaccination, obviously this is a 1-dose vaccine that will be given in the first instance, so we shouldn't see a vaccination history. If you do, we know then actually that this person can't get the Janssen vaccine. So that's, by going in through this way, you see the vaccination history. So I would recommend going in through this way, confirming the person is who they say they are, checking their ID, and then at the bottom of the client section, you can save and vaccinate as that grey button is available at the bottom of this screen. Just in terms, and I think Alan might have mentioned this earlier on, but the PharmaVax system is not a decision support tool. So if you did see a vaccine history there and you ignored it, it won't preclude you from giving another vaccine to that person. So the system won't stop you doing something that you shouldn't do. So you need to be very aware of the clinical guidance and the dosing schedule. In this terms, it's only one dose. They shouldn't get another vaccine if they've had a vaccine in the past in Janssen. But equally, it wouldn't stop you giving several doses to the one person in quick succession. So it is not a clinical support tool at all. It's purely a record tool of the vaccine you've given, and a reimbursement aspect in terms of getting payment back for giving that vaccine. So just be aware of that. It's not going to pop up and say you shouldn't give this vaccine to this person. So if you go through the client section, you will then see if there is a vaccination history. Again, for the Janssen vaccine, the vaccination history obviously precludes them from getting the Janssen vaccine. The first thing you'll be asked to do is look for a vaccinator, who the vaccinator is. It will default to whichever vaccinator is the first vaccinator on the system. So if there's only one pharmacist vaccinating today, it will just stick at that person. So you don't need to go into this continually, but it will ask you if you want to change it. But whoever was there at the start will be there. One of the questions coming through in the chat box has been, can I use it on different computers? Yes, you can. There are some specifics of some browsers that aren't supported from the system, but you can use it on other computers and not just your dispensary computers. So you first off, you would choose your vaccinator, whoever's doing the vaccine, and then you go to recording your vaccination event. I did discuss this with one pharmacist who phoned me today. This screen is something we can't play around with the system and record a vaccine event once you have a live system, because that flows up into the COVAX system and will create a record for a person. So you can't create a vaccination event against a person unless you're actually doing an event. So this is not a system that you can necessarily play around with. No, you can add clients, but the moment you add a vaccination event, it will go up into the system, and then it informs the wider COVAX system. So another query coming into the chat box was, do I as a pharmacist need to do anything in terms of a person's vaccine certificate, if the travel certificate, whatever way that actually ends up looking? No, you don't. This all feeds up into that centralized system. So any vaccine that you get given a pharmacy, you can assure the person that will go into their record, that will be available when or if the European vaccine record comes into place in Ireland. In terms of recording the event, you first of all have to find your person. So in the top box, you find the person, and then it will pre-populate the person that you're vaccinating. Medically eligible, this is the form I talked about earlier on. This is the series of questions you have to check before you can tick that. Now, for each vaccination event, there will be an ID. So if you want to link this vaccine record card to the vaccine event, you can put the vaccine ID at the top of this form, along with the person's name. You'll also need to tick what you checked their identity with, and that consent was given or not given. And in the operational guide by the HSE, it does go through in the appendix the consent and what you need to do to get informed consent. So it won't let you get past this bit of the vaccination event unless you tick that they're medically eligible and you have consent and that you have their identity for obvious reasons. So that won't let you proceed to log a vaccine unless they're all ticked and correct. Then you pick your vaccine, and the one up here is that we have used at the moment is Vaxzevria, but and it obviously is a 2-dose schedule, but you will be using Janssen vaccine, and you will probably only have the first batch in your pharmacy initially, and so that batch will be the batch that you will choose, and it will be just dose 1. When you hit save, that is that vaccine record. So there is no way to get it back in the system. So you will need to double check that before you hit save, because that will become that person's record. And there is support if something goes wrong, but really it's the same level that you would do in terms of your dispensing, checking sure that everything's correct before you hit the save button at this point, because that's when it will generate the claim to the PCRS and also claim up to the COVAX system to generate a vaccine record for that person in the centralized system. So before you hit that save button, double check everything is correct for that patient, and then you hit the save button, and that's that vaccine record. Now, because it's a 1-dose vaccine, that's the only record you'll have against that patient, but if it was a 2-dose vaccine, and for those pharmacies partaking in the rollout of the Pfizer vaccine, the Comirnaty vaccine, you will be able to go back into the client and add a second vaccine to that person's record. So it's very much like a PMR system. You have to start with putting your person's details in, and then you add a vaccination event against that record. There is a query coming into the chat box. Do I need to keep a record on the PMR system? No, you don't. This is the record that you keep. This is the record. No additional record would be kept, but you will need to keep your paper copies in terms of your medical eligibility checks in your pharmacy. So I might just hand back to you now, Ellen, for the reports and reimbursement.
Thanks, Claire. Okay, so one of the last sections then on the system is the reports section. So there's not a huge amount in here. The reports are pretty basic, but they are entirely fit for purpose. What I mean by that is that when you look at this report section, it will give you a record of any vaccinations that happened in your pharmacy on that day. And you can print that off and use that as your daily audit report. You can have it signed then by the vaccination pharmacist, put in the details, maybe put your pharmacy stamp on it, and keep that on file in your pharmacy. So that's your daily audit report. But don't worry, you can then go back and do other daily audit reports from days before that. So you can go back through the days that way through the report system. You also have access to this system for looking up patients that you have vaccinated. So you can go back in and see their records again once you have records in your system. So the system will be available to you to have an electronic record of any individual vaccination event. And you can then use it for creating your daily audit report. So that's just an important one to note there. So that is what you'll be using. The other thing is that this information will be used again, just to repeat, by the PCRS for reimbursement. So maybe over time we might have an enhancement to the reports functionality to allow you to do a date range, so you can use those kind of reports for reconciliation against your reimbursement. Next slide. Okay, so Karina's going to come in here and talk about the support available to you from the HSE and A2I access to information.
Thanks, Alan. And thanks to yourself and Claire for inviting me along this evening as well. So, guys, from a support point of view, you're going to be well covered, first of all, I should say. You're essentially going to have two teams looking after you. So the first team will be a group that you're familiar with already if you've ever had any health mail support issues. So that's the support team, which is serviced by 3, who are the health mail service providers. So if you have any issues logging into HSE PharmaVax, if you can't remember your password, if you need a password reset, you will contact the health mail support team, which is the ICT support at 3.ie or the 1-800 number given on the screen. And this is the team that you should be familiar with already from health mail usage. Likewise, if you have any issues with your verification code, and that was the 2-factor authentication code that Alan mentioned earlier. For example, if you can't remember where that code has gone to, if you can't remember what secondary email address you registered at HealthMail, just give the team a call and they'll be able to tell you it's your pharmacy account or your Gmail account or whatever it is. So again, that's the HealthMail 3 support team for that. Similarly, if you need to have your PSI number updated, it's the HealthMail support team as well. Now, like Claire mentioned earlier, we have run an update survey several times over the last couple of months in preparation for this. And I know most recently it was sent out even this week to a number of pharmacies just to capture any last minute updates that may need to be made in terms of your PSI number, your secondary email account, or even just to confirm that you have the correct HealthMail account for logging into this. And we got a good response to that again, and those updates are being made tomorrow morning. So we're hoping that we will have absolutely the most up-to-date information that we can get from the pharmacies, so that you will have no issues logging in or no issues trying to find your verification code. If you do, they're the numbers that you call. In terms of usability of PharmaVax, or any system issues, any errors, any application issues whatsoever, you'll be calling the HSE support team, which is our technical support team, and that's HYHIDS.support@hse.ie. We have made a couple of mobile phone numbers available there as well, in case you would like or prefer to speak to somebody, but our preference is that you send an email. Our response times are very fast on email also, and also the advantage of that is you will get a ticket which you can use then, as a reference for follow-up and stuff as well. So again, the A2I HID support team is for any usability issues, any just general queries on the system, how-tos, or any application errors of any nature. So there are your two main contact points. I will be contacting everybody, as Claire said, for the pilot group for the soft launch on Monday and the general release on Tuesday. I'm hoping to send that email to your health mail accounts tomorrow afternoon. For the pilot group, like we say, there'll be about 15 taking part in that, and we will ask for some feedback then throughout the day on Monday, just to ensure that everything is as it should be, the system, that you aren't experiencing any application issues, that everything is working, the full flow from logging in to submitting, if you need to contact support, that everything is flowing correctly. We're hoping, though, that there won't be any issues. We have a huge team working on this from our point of view on the tech side. We have 18 people working on it. We had a lot of work done prior to the cyber attack, and then we lost our system access for about 3 weeks. So we have frantically brought everything back up just really in the last week, finished off the development and pushing to live, pushing to testing and live as soon as we can to have it ready for you. We're very enthusiastic about the system. It's, as Alan and Claire have said, it's a very simple system. There's nothing complex in it. We feel it's quite intuitive. We may be adding further functionality to it, over the next couple of weeks, but certainly as in the here and now, it's a very simple system, and we hope that it works well for you. But upon saying that, the support, like I've said, is available, and when I email you out your invitations to join and to register tomorrow afternoon, I will be sending out a user guide with step-by-step instructions and some screenshots similar to what Alan had this evening. I'll also be sending you a copy of this support details, so you'll have that, and just a fairly simplistic one-page document just with the login, the URL login, just a reminder that it's your health mail details, that the verification code goes to your secondary email address, and just some very simple steps that you can have that in front of you if you just need to glance at one page to see how does HSC PharmaVax work. So I hope that will be sufficient. Like, you have all my details. I'm happy to share my details as well if you need anything, to contact me directly. Otherwise, best of luck with the system, and I hope that you enjoy using it.
Thanks for that, Karina, and thanks for joining us this evening on this. I just to say, we will also put the HSC support material up on our website as well, as you're receiving it in your email from Karina. There is a couple of questions in here quite specific to the secondary email addresses, and while they're different questions, the answer is still the same thing, that you should actually call the HealthMail support number tomorrow. So one question is using the same secondary email address for a number of pharmacies, so that might cause confusion. So it might be better to actually have individual secondary email addresses for those pharmacies. So I would advise to contact the health mail support on that issue there. So let me see if there's any other specific questions to health.
I've got them just flagged here. I'll just read them out actually, and either or yourself or Karina can take them. So the question is there a two-factor verification every time we log in?
No. So this is going to be every day you log in, you will have to put in a 6-digit verification code. It will be reset at night, so every day, so not every time you log in.
Another question is, can the vaccination report be generated on a monthly basis in order to reconcile with HSE payment?
So my understanding is at the moment we are only able to produce a daily report, and over time we might have enhancements to that functionality in there to allow you to do a date range. So for example, a monthly report. So that would be something we'd be aiming towards.
And then the last question, which I think I answered, but I might just answer it again, which is, can we do dummy runs with mock patients as a confidence booster? Unfortunately, you can't. You can do a dummy run in terms of entering a patient details, but when you add a vaccination record, you can't do a dummy run, unfortunately. It was the same with the GP system. It's just of that flow up into the central COVAX system. So they're the main ones in the PharmaVax, I think. I might just go to the next screen, Alan, which is just in terms of some of the support links, and then I'll come back to some of the other questions that are flagged that I'll try my best to answer in the time we have left. terms of useful links, immunisation.ie is a useful resource. I know one of the questions that came up was, where do I get that eligibility form? It is up at the very top of that resource under healthcare professional resources. So that is in the very top section of that report. I've also just put in the link there for the temporary HSE land training. That's replacing the Eventbrite link that was sent out, and we did send that link out in our newsletter this week. We have our own vaccination resources, and that's a link to that. And also on our website at the moment is the HSE operational guidance. I know that was emailed out to you, and the HSE are planning to put it on their system. It's just not up in their system yet. So if you want a copy of that, it's on our website for you to access until the HSE have it up on their system. There is various other information resources there where the SNPC and HPRA updates in terms of what I said, and we will see a monthly update from the HPRA in terms of side effects and potential any effects that you want to read up on in terms of your counselling advice. And just a reminder that pretty much we have everything on our website in terms of the excipients list, the policies and the SOPs. And as I mentioned, the SOP will be updated tomorrow to reflect just the picture of the withdrawal of the dose. So Alan, I'm not sure how much time we have left for questions.
We have very little time. I want to give Karina the opportunity to leave because I know you have a meeting at 8 o'clock, so you can take this opportunity if you need to leave for that. Any of the questions around verification codes are similar questions. So look, you're going to have to enter this only once a day, not for every machine in your pharmacy, just once in your pharmacy. So I think that answers a number of the questions that are coming in there. Another question is around the email and what if the email address is of a pharmacist who is on holidays. So look, this is another reason why you need to maybe contact a HealthNet support, because it needs to be an email address that's accessible by anybody vaccinating in your pharmacy. So that's something you need to consider there.
And the other bit, and just before we close today, we will update our FAQ questions. I can see quite a few questions coming in that actually are answered in our FAQ document that's on our website, and there's some around insurance, etc. They're all answered already in our FAQ, so do look at that. And I will update the FAQs to answer any questions that have come up that we haven't answered tonight. And if I cannot answer them, they will go off to the HSE and they will update their FAQ document with any of those questions that we can't answer internally at the moment. So I think we're probably out of time, are we, Alan?
It is. It's 2 minutes past 8. Look, if we haven't got to your question and it's not in our FAQ, we'll go through the questions that we received this evening and make sure that we have answers for those in there. In some cases, we might need to contact you directly, but a lot of the questions here are either in our FAQ or there will be when we update it. So thanks to everybody for attending tonight. It was really good attendance. This will be recorded on available on our website tomorrow, and as well as any other supporting material as well. So if you have any questions, you can contact the office as well. Thank you, everybody.
Thank you.
Thanks, Karina, as well. Bye-bye.